So that brings us to another question that comes up very frequently, which is, what are some of the potential complications of vaginoplasty?
Made rapid advances in it, in this field. Vaginoplasty, like I said, there's multiple different operations going on at the same time. The final result has to be functional as well as aesthetic. So you can have some functional issues, you can have some aesthetic issues, but that's further down the road. In the early postoperative period, less serious side effects are very common, and more serious side effects are thankfully uncommon. So what are the less serious side effects? Meaning wound separation, wound healing complications. So, we put two areas of tissue together. If there's a separation, there's some gunky little stuff in there or some mild amount of infection. That is actually very common. Anywhere from 30 to 60% of patients will experience it. In fact, some surgical groups don't even count that as a complication because we just say it's a normal part of healing. Almost always that can be taken care of with local wound care. So, we don't have to go back to the operating room. We don't have to reoperate to clean out any of those wounds. But every once in a while, we do have to. Some of the other earlier complications include injury to the rectum, which can lead to a fistula, so a normal communication between the rectum and the vagina. If that happens, that's a pretty catastrophic complication, and that definitely requires at least one, if not two or three further surgeries to repair that problem. Urethrovaginal fistula, which is an abnormal communication between the urethra or the prostate or the bladder and the neovagina, is also very uncommon. And but if that happens, that is also that also requires multiple reconstructive surgeries down the road. These two injuries and these two complications are thankfully rare. We haven't had one so far. Doesn't mean it's not going to happen. It's a numbers game. But if you look at the largest series and combining different series, probably a 1% chance of injury to the rectum or injury to the bladder or urethra. And not to belabor the point, if there is an injury to an adjacent organ like the bladder or the rectum, the complication arises not because there is an injury, but because there is lack of recognition. So if there is an injury to the rectum or injury to the bladder, and we recognize that during the surgery, that is fine because we can repair it and you're still normal postoperative course. It is when we don't recognize it, or it's a delayed injury that happens after a week to 10 days, that's when the cascade of complications really takes hold. So these are the early perioperative complications. Longer term complications, it's probably, you can call them complications, you can call them issues that require reoperation or intervention, however you want to call it, but they can be grouped into functional as well as aesthetic. So aesthetic meaning if patients don't like how things look. What we tell our patients is, cis women don't get to choose how their vaginas look when they're born. Similarly, how a vagina looks after vaginoplasty in trans feminine patients is very variable on the existing anatomy and how the patients heal afterwards. There's a wide spectrum of what normal is, and there are multiple online projects and online resources, especially, for instance, the Great Wall of Vagina, which is mandatory reading as a part of getting into it. Yeah, Flannery has a big blow up of it on, so I mean it just goes to tell you that there's a wide variation, and if you end up on that spectrum, then we'll probably tell you you're okay. But despite that, some patients do want to have a little nip tuck here to try and correct some asymmetry here and there. So that's something that happens. That is not, we don't have a good grasp of how common that is. I would suggest probably about 20-25% of the time. The other is the functional component. So functional component meaning the urethra. If the urethra is not located at the correct position, women can have trouble with a slow stream or urine coming out of the toilet instead of going down in there. We are very, very judicious and persnickety about how to do that urethral work, so we haven't really had a whole lot of issues with it, but it can definitely happen. If it does happen, it's a very easy thing to correct. Clitoral sensation within the clitoris is something that is very, very dependent on surgical technique, in my opinion. I use 4x magnification loops, find the nerves to the clitoris, dissect them out very carefully, and make sure not to use any cautery, which is electrocoagulation energy, anywhere even close to the nerves, because we may not see any damage, but it can happen down the road. We've thankfully not had many issues with clitoral sensation, but we've definitely taken care of patients who've had surgeries elsewhere and have issues with that. And then finally, the one which can be one of the more vexing problems for patients, their families, as well as physicians, surgeons, is vaginal stenosis. So, we are creating a vaginal canal. It is kind of sort of like a surgical trauma. There is not a canal there. We are cutting through skin, some tissue underneath, as well as some of the muscles surrounding it, and we create a canal. And whenever we cause a surgical injury, that area is going to want to scar down. So vaginal stenosis, meaning loss of the caliber of the vagina, as well as vaginal shortening, loss of the length of the vagina, that is going to happen. That is the natural state of things after a vaginoplasty, vaginal canal creation. In order to circumvent that, we place patients on on scheduled dilation regimens, which can be weaned with time. But even if patients are compliant, or sometimes if they have other things going on, we do see anywhere from 10 to 20 to 25% rate of vaginal stenosis, and sometimes that can be something that can be addressed with just upsizing the dilators, but many times they require repeat surgeries, depending on how much of the vagina we need to reconstruct again. Sometimes that can be outpatient, sometimes that can be more extensive kind of stuff. So those are kind of sort of the long-term issues that one can expect to encounter after a vaginoplasty.